Thank you all very much for joining us here today. A little over 1 year ago, in the middle of a period of protest after the death and murder of George Floyd, there was a huge civil rights reckoning in this city and across our country. I stood here and committed to the people of Seattle that we could re-envision and reimagine what public safety looks like in the city of Seattle. And we've been working to do that in the last year. And in recent weeks, we've seen the culmination of some of that work. We've seen $30 million in proposed investments by the Equitable Communities Task Force that the City Council is now considering, and we hope that money gets in community as soon as possible. We had the launch of a $30 million strategic investment fund to really offset the pressures of displacement and gentrification and make sure that there can be both cultural and business spaces here in the city of Seattle for the BIPOC communities. Just in the last few weeks, we've awarded over $10 million in community safety investments via RFP through our Human Services Department to see what efforts we can do in community by supporting community-based organizations. And yesterday we announced new measures to combat the rise in gun violence and really support some of the community programs there. But we know at the same time our city is also facing enormous public safety challenges. Our region has experienced a significant increase in gun violence and firearm-related homicide over the past several years. Homicide is up 42% in our country. And since the onset of COVID here at home, now by August 2020, we'd already surpassed the number of homicides that were recorded the year before. This year we're at 23 to date, one of the higher ever. Chief Diaz will be talking about that. I want to thank Councilmember Herbold for being here. We have, as people know, we have different approaches over the last year on what we should do, but we are unified in finding ways to both increase public safety, but also to make sure that we're supporting those communities most impacted by police and other systemic racism to really change how we do things. Part of reimagining community safety means providing meaningful and effective alternatives to a sworn officer going to a scene. There are significant numbers of calls that police respond to that they themselves have determined they didn't need to be the ones going. Often these are non-emergency medical and non-criminal calls. These calls often turn out not to be criminal in nature and don't require an armed police response. As part of our effort to reimagine policing, we've been taking a deep dive into what are the calls that police go to, what are the ones they really need to be at, and how do we free up the time of officers so they can be directed to where they're needed the most. We've learned that we need a specialized triage response model to respond to some of these non-emergent calls and free up the time of officers and have the best ability to determine what's happening in the field and who needs to respond. This will be an extension of our 911 dispatch system and will be staffed by professionals who are experts in de-escalation training, who have system navigation knowledge to be able to determine where in the system people need to go, and are people with deep connections to the community. We've seen how effective these alternatives can be. Our Health One program that we launched right before the pandemic has provided a critical resource to help people with mental behavioral health issues and substance abuse disorder, and in those non-emergency medical situations. It has been, when we unveiled it at the time, I think the chief will remember, I predicted that every part of town would want one, and indeed that's the case. And with council, we have been able to add more units to Health One, and in next year's budget, we hope to really support that whole response system. But we also need a more rapid response, specialized triage response model, which will be a critical resource to get people from 911 calls to a place to determine who is the best person to respond. Is it a medical response that's non-criminal that Health One can help in? Is it non-medical criminal emergency that we need police to? Many of those calls you know right from the instance when someone calls 911, but many of the calls when you call 911, we end up sending police when police aren't needed. As we continue to reimagine public safety in Seattle, it's critical that we create systems that enable us to send the right team to help. When a person calls 911, we want to make sure they get the help they need. Today, you'll be hearing from leaders from across our city to talk about this approach. Councilmember Herbold, Chief Diaz, Chief SCOGGINS, Chief Lombard, and together we are proposing a number of new investments that will provide residents with an alternative model for some 911 calls. Together with the expansion of the city's a very successful community service officer program, we are making real progress in our commitment to reimagine public safety. I also want to make one thing very clear. I know, and the two chiefs know, that right now we need more officers that can respond to 911 calls. There are calls that need a police officer to respond. This program will help us free up those officers' time so they can go when they're best needed. But it also is no replacement for the efforts we are taking to hire and recruit more officers in the city. And with that, I'd like to turn it over now to Councilmember Lisa Herbold, who chairs the Public Safety Committee.
Just want to first start off with my thanks to Mayor Durkan for her leadership in responding to the public call for resources to be focused on non-policing responses to crisis. We have a continuum of crisis response in the city of Seattle that includes police officers, it includes the Health One system, and it includes some of our nonprofit providers who also do crisis response. I've long said that we have the infrastructure in place in order to divert more crisis response calls to the continuum, but we need to grow the capacity and we need to identify where the gaps exist. This new triage one response system is going to fill one of those important gaps. The call analysis that's being done on our 911 calls shows that the triage one system will be able to respond to approximately 8,000 calls a year. These are calls that do not require an armed police response. Throughout 2020, the calls from community to invest in alternatives were consistent, loud, and clear. We know that not every call to 911 needs an armed police response. Earlier this year, we expanded the Health One to a Health Two unit. Later this year, we're going to add a third unit. Again, this is the result of the budget work that we did in the wake of George Floyd's murder last year. The Triage One proposal is a creative and data-driven innovation. It has been, again, the gap has been identified because of the call analysis that has been done to identify the types of calls that don't need police officers to respond. I'm increasingly hearing from constituents who contact my office and say they want an alternative to a police response when they call 911. And I'm really pleased that we're going to be able to offer additional options for people who are seeking help for their family, friends, and neighbors. 911 call takers have been called the gatekeepers for the entire criminal justice system. So I've been really focused on the 911 dispatch, working with Director Lombard. In order to ensure that the 911 dispatch call takers can properly divert calls to non-police responses, they need some help. They need funding to support a protocol dispatch system, which I am proposing funding for in the council's current second quarter budget supplemental. This funding will allow the dispatchers that were recently transferred from the Seattle Police Department to the Community Safety Communications Center to better deploy the new Triage One responders. The protocol system will also allow for better data analysis, so we can continue to evolve the dispatch system to identify other types of responders to fill those gaps. It'll give us more granular data to be able to and analyze the call types. So this is a really big piece of work that the council and the mayor's office and the departments have been engaged in this year. I have been really focused on trying to figure out, we know we might need to create some new things. You've heard us talk about the Cahoots system, the Cahoots program. That's another type of crisis response. But this is something that we can do now. We don't have to create something brand new by working sort of within the current crisis response, but identifying some new job types. And these Triage 1 folks will fulfill that gap without having to create something brand new. We have been seeking some of the work that the mayor's interdepartmental team has been doing about that next step that might involve creating something new, like a Cahoots program, or the expansion of Seattle's current downtown emergency service center mobile response teams. We're going to be hearing in my Public Safety and Human Services Committee on Tuesday the almost a years-long work that the IDT has been doing, their call analysis, and some recommendations for further next steps. And I'm really looking forward to more of that work. And with that, I think I'm turning it over to Chief Diaz. Thanks.
Okay. Good morning. I'm Adrian Diaz, Chief of the Seattle Police Department. SPD has spent months listening to the concerns of the community and is committed to re-envisioning public safety. We hear you and agree. Not every 911 call needs the response of a police officer, which is why we're especially proud of the community service officers. CSOs are civilian employees already deployed throughout the city to help residents and businesses in non-criminal calls navigate services, engage with communities, and support youth that are at risk. Yes, our nation and our city are experiencing the trauma of rise in violent crime. Yes, there are people in Seattle armed with guns who continue to prey on our communities. We have seen a significant challenges to criminal activity from the increase in aggravated assaults and arson, to name a few. And in the interest of public safety, those are the types of 911 calls that will always require the response of a police officer. We will always need police officers to focus on significant criminal issues facing our city. We're already committed to continuing the important work to protecting all people of Seattle addressing criminal activity. SPD welcomes a wide range of public safety services that will soon include the new Triage 1 team. Currently, all persons down calls for our Priority 1 calls, which means that officers must drop all other calls for service and respond with a minimum of 2 officers. And a majority of these calls are because people are experiencing addiction or health crisis. A majority of the time when SPD responds, we still need to call another entity to respond. And almost all these calls are not related to any criminal activity. With Triage 1 responding to these calls and to these crisis and welfare checks, more SPD officers in our already diminished department will be freed up to respond to crime. In addition to supporting the efforts of Triage 1, today we are announcing that SPD will expand the CSO program. Civilian-led community safety is an ongoing commitment of the SPD. We hear you loud and clear. Not every call to 911 needs a police officer to respond, but when it does, the men and women of the SPD will be there and will support Triage 1. I'd like to turn it over to Chief Lombard from our community safety.
Thank you, Chief Diaz. My name is Chris Lombard. I'm the Interim Director of the new Community Safety and Communications Center. Thank you to Mayor Durkan, and thank you to Councilmember Herbold and the other chiefs here for the support in re-envisioning how emergency response can happen in the city of Seattle. 911 has always been kind of in a pinch as far as trying to figure out as quickly as they can in 60 to 120 seconds what's really going on at a situation where somebody's calling for help, and to best deploy the appropriate resources to mitigate or help the public in those efforts. The challenge is that you're working on very limited information, and we've had a lot of challenges in trying to match the appropriate resources. We see this new Triage 1 system as a really innovative way to extend the time frame that we have for those lower emergency or non-emergency type events to get people the resources and the help that they need that'll get them through their challenge at the moment. In working with the police and working with the fire department, we've tried to identify, as Chief Diaz said, a category of incidents that kind of fall into this middle zone between the different types of emergency, whether it's medical or for law enforcement. So we're excited to see and pilot this program to try to identify and get people the help that they need. With that, I'm going to turn it over to Chief Scoggins. Go to this side.
There we go. It's kind of a shuffle here. Good morning, everyone. My name is Harold Scoggins, Fire Chief of the Seattle Fire Department. I want to lead with a thank you to all the men and women of the Seattle Fire Department for all the work that they do each and every day serving our community. You see them out there every day engaged and really working hard to do the best that they can. I also want to thank our mayor for her consistent leadership in trying to help our city improve and be better, and Councilmember Herbold for all of her support as chair of the Public Safety Committee. What we know is when we deployed Health One in November of 2019, we took a chance, we took a risk, and we actually tried to do something different to better serve community. And what we think by the information that comes in, that it's really working well. And I'll just give you an example. For the first 6 months of this year, we enrolled 459 people into our Health One mobile integrated health system. That same 459 people in 2020 accounted for over 4,000 fire responses. So now they're enrolled in our system. Now we're doing follow-up. Now we're really trying to close the gaps with our case managers. We see that's really making a difference. Health One is tied to a medically related comorbidity. So generally there's multiple things going on. There's a medical issue, there's substance abuse, there's crisis, there's all these other things that could be happening. What we're talking about here with the new triage response is those other type calls that may not have a medically related issue that's tied to it. You know, it's really an exciting time to work with the police department and our mobile integrated health team to really help design this system and try to get it right, because I think we're doing that with Health One. Many people may ask, well, what will be the difference between this unit and Health One? And generally it's the medical related nexus to Health One and the non-medically related nexus to this new triage unit that Deputy Chief Lombard spoke to. Those calls come in, our dispatchers are working hard to filter those words and try to get the right response to the scene. But the triage unit can help with that as it launches in community with very intentional training related to crisis training, de-escalation training, system navigation training, and other things that will be identified. They will be able to help either call for assistance. Maybe there will be a need for the police department to come help because the patient just needs that. Maybe there will be a need for the fire department to come and pick them up and take them to the hospital. Or maybe there will be a need to help with the system's navigation. But right now we have a gap, and we know there's a large bucket of these calls that basically are falling to the Seattle Police Department each and every day that really probably don't need to be there. So our goal is to try to get it right. I think we're getting it right with Health One. As the mayor and Councilmember Herbold mentioned, our third unit will be coming online in the fourth quarter of this year, and we're really excited about that. So this will be another component under our mobile integrated health platform. And that's really important because we have case managers, we have our vulnerable adult program, we have our high utilizer program. So all these programs, along with Health One, are really trying to help with the population and get them to the right place. And this triage response component will be tied to that. So thank you, and I'll turn it back over to the mayor.
Thank you, Chief. All right. Thank you very much. So I think it's, I want to mark something else. This is the first time we've had a press event here where not everyone's in a mask. We are not yet through that emergency. As your mayor, I have to remind people that COVID is still here. We're seeing an increase in the number of cases with the Delta variant. And if you know anybody who has not been vaccinated, please urge them to get vaccinated. It is the #1 thing we can do to protect our community right now. I want to thank everyone who's here today, but mostly all the people in the IDT who really dove down into the calls to really analyze what are those calls that we could start offloading from Seattle Police as the initial response. Because right now, usually it's a police officer who's doing that emergency first responder triage. They arrive at the scene, they make the determination, you don't need police, we need fire, or we need a family member, or we need the case manager. This is going to give us another tool, almost as an extension of 911 itself, in those calls where we're not sure yet, but we know that they're not criminal, that someone can go and make a determination as to what to do. You'll look at the data, we're going to provide you with all the numbers, but this is hundreds if not thousands of calls a year that we can free the police from responding and have a better response for the community and make sure that those people are trained in de-escalation, that they're trained in how to navigate the different systems and determine what someone needs, and then to call what the right help is. So again, this is another tool that will work very closely. We're working a lot of the details still. Really want to thank both the fire and police unions to being very forward-leaning to find solutions to these to get the right people to the job. So looking forward to this moving forward, and I think it speaks to the suite of things that we're doing right now. There is no one solution for community safety. We have to have a range of tools to address what we're seeing and to address the real and legitimate calls for a different approach from last summer. So with that, any questions? Matt?
Yeah. Don't expect this to happen to me. I mean, I don't expect you to be briefed on it because it just happened. Senator Dingra and Senator Peterson just put out a statement, and it's titled, "Police have responsibility to show up and help people in crisis to get treatment." And it goes on to basically say that police, even though they have discretion on these things, have a duty to show up at crisis events like this. Kind of not shirking its responsibility. That's kind of what the gist is. It kind of comes just ahead of what HB 1310 starts and takes effect this weekend. Just wanted to care to comment about the police's responsibility to show up at these crisis events.
They are showing up. We had almost 17,000 crisis calls 2 years ago. This is a regular part of what police officers are seeing day to day. And it's what I said last summer. If you put police officers and community at a table together, I think they'd have a large agreement on some of the calls that police aren't the best response. And so I think that what we're looking at here today is what are those calls where there can be a better response. And I have to say, thank you to the men and women of the police department who have been showing up throughout this year and last year, and to some very, very difficult, challenging calls. And then working with the fire department to see how do we get Health One integrated better? How do we make sure that the 911 dispatchers are sending the right people? I listen to a lot of 911 calls, and I was just talking to Chief Lombard that, our new approach is going to be new training for them too. A new system on how do they ask the right questions and emote the right level of concern for people when they call 911. So I think they were going to revamping it, but nobody's going to shirk their duties. We're going to do what we can. At the same time, as you know, Matt, we are incredibly taxed right now. We do not have enough officers. And the chief is working very hard to hire additional officers, both laterals and new hires. But this also gives us this opportunity to be looking at different ways to respond to things that the police themselves say they don't need to be there. David.
Who exactly is responding, and have they said that they have the capacity and ability to
So this is going to be a new effort. So it's going to start next year. So we go to council, assuming that they give us the green light to go ahead. The details will be, the next stage will be worked out, very similar to Health One. We announced it, we got the go-ahead to do it, then we'll put the team together to see, looking at the data, what's the best approach and what's the best affiliation. It could be augmenting Health One and a team there. It could be a different kind of, but it will be responders whose job it is to really do the additional triage that you can't do in the dispatch center. Respond, and most of these calls right now will be a combination of what they call man-down calls or welfare checks. Most of those happen in the downtown core. Most of them happen during the business hours. People see someone passed out, they don't know what to do. They don't know if the person's sleeping, they don't know if there's another problem. They see someone who's clearly having a mental health issue that needs help, so they call 911. This will give us an ability to do both welfare checks and man down or distress checks that may not have that medical component where we know Health One would roll.
So whether it's DESC, Health One, we don't know that yet.
It will be a city-based team for this. And not to get too wonky, there's been recent court decisions that are going to require us in any kind of 911 response to make sure how we design that program.
This is actually for Chief Diaz.
Okay.
I mean, given your letter yesterday about kind of the nitty-gritty of implementing 1310 use of force standards, is there any way in which this new team will intersect with the implementation of new use of force standards for Terry stops, for instance?
No, so typically for exactly what Mayor Durkan is kind of expressing is that we have these person down calls. Typically we respond out. Sometimes it could be a person that could be experiencing some sort of medical issue where they're could be vomiting, and for us we respond and we have to call fire out. Having somebody to be able to do that, not having police officers respond, frees up our officers' time to be able to focus on just criminal activity. When it comes to 1310, in relation to people in crisis, we still respond to people in crisis. Like the mayor said, we've had 17,000 calls just a few years ago. We average way over 10,000 calls for service and just dealing with people in crisis. And we still continue to respond to that. We find ways to de-escalate and get people the treatment that is needed. Really, when it comes to HB 1310, the question is how to ensure not to use force in dealing with people in crisis. Right now, we use about 1.67% in dealing with people in crisis, use force. And so we have a very, very low level. And so we continue to respond to these calls. We still continue to try and find ways that we can get people the resources that are needed. But for these specific calls, like where triage is, we find ourselves literally calling another entity to respond because it's not really for the police to respond because there's no criminal activity, or sometimes not even people in crisis. They could be experiencing either a medical issue or they could be passed out for a variety of different other reasons.
There's no real overlap with areas.
Yeah.
Dan.
Mayor, I just want to, I know the details are still being worked out, but just to sort of walk through it. So someone sees someone in distress or in crisis, not necessarily a medical issue, calls 911, and the dispatcher then sends this new triage 1 team.
Yeah, so I think there'll be a combination of things. First, as we add this capacity, we're also going to be reconfiguring how 911 dispatchers respond to calls themselves. So there'll be training for them to ask different set of questions, more comprehensive questions. Once they get the information they need, then they'll know, okay, this is something where it's not just someone who's in distress, but it's someone in distress with a firearm or a knife. We need to make sure that we can have a police response. It's clearly a medical thing, so we have Health One respond. But we get hundreds, if not thousands, of calls of people that they call man down, someone who's passed out, or someone who, sometimes a welfare check, where it's, I haven't seen my brother's not responding to the calls, what do? There's no indication of criminal activity. Police respond, police get there, and they're basically right now acting like that triage team. They get there and say, we weren't needed, they just fell asleep, or we need an ambulance, or we need Health One. So this gives us, the response for community safety has many, many levels. And what we're trying to do in this period of time is build up the capacity to respond in the smartest way possible to thousands of calls we get that we know police don't have to be the responders.
Thanks. Do you know if the new team that's sent out into the street will be civilians or fire or police or some combination?
It probably will be a combination. We're still working that out, looking at the calls and then thinking about, as we expand Health One, what does that look like? We just gave $10 million in community-based organizations that are filling different gaps. But this is really a gap where it is government responding to a 911 call. And how do we make sure that the people that go there are adequately trained, as they need to be, and know how to both arrive at the situation and call for the additional help that's needed?
Last question.
Wait a minute. There's so many questions here. We'll take a couple. David?
Okay. Yeah, I guess, do you have some sense of how big this needs to be, like money, budget-wise? And then I also have a question for Chief Diaz, although I don't know,
Yeah.
sort of separate.
Yeah.
Same here.
So I'm going to save him from those. No. This is very much like when we rolled out Health One. We're going to really make sure that this pilot is something that we monitor, test, and see what the results are, and then grow it. We anticipate that there will be a need for this kind of response across watches across the city. So you'll need, people call 911 24/7. But we're seeing in these types of calls, most of them happen between 9 and 5, Monday through Friday. And so it's a different kind of response. But as we look at the data, we may see that there's this exact kind of need in other areas. So to start with, we're going to be really focused on addressing the need that the data showed us, testing to see how that works, and seeing if it reduces the need for police. And if police then are having to be called, what are those kinds of calls so that we can really get this right?
And Chief Diaz, can I just clarify on your statement on HB 1310? Do you see this changing the way that police right now engage in like emergent detentions? Like, will we be seeing?
Are you talking about 1310?
Yeah. Will we be seeing fewer
Yes.
emergent detention holds?
So right now, when it comes to emergent detentions, you know, we average about 3,300 emergent detentions, our ITAs, a year, with many of them not having any level of force and to detain somebody and get them the treatment that is needed. We are currently just trying to evaluate every aspect of 1310 to understand the true impacts. We know that the Attorney General next year in July of 2022 will issue out a model policy. So we, as the police departments, are going to have some different changes over come July 25th. And we're going to constantly be looking and evaluating throughout that whole process how we need to adjust our response to ensure that officers are not using force in these type of situations, to make sure that we're in compliance with the legislation. But we also have to be mindful of there are officers' concerns because we also have the decertification bill that the Senate, SB, and I think it's 5051, that if an officer uses excessive force, that they could potentially be decertified. So without not having a model policy and knowing that they're could potentially have a decertification process, we are constantly evaluating every little thing of these legislations and making sure that our officers are doing the right way to respond to these types of calls for service.
All right, I got to run, so thank you very much.
Talk to the chief.
If he wants to do one-on-one later, but we're going to break this up. Thank you, guys.